we did not do that. But we are here to discuss all these issues and improve on our data collection, analysis, and use for decision making. Thank you.
Thank you very much. So we'll take the in-person questions. No, you can take that. You can take the microphone. Yeah, let it face that. What would be the best location for you? Right at the front. Okay, sorry. Let's come back. You're in the way of the camera. So please, we'll take the first question. So you can kindly walk up to the microphone and then you face the camera for us. Please come. Are you also going there? Oh, sorry. Okay, then please come. He had raised his hands earlier. That's how come I called him. Sorry.
Good afternoon.
Good afternoon.
So my name is Lamont Evans. I'm the president and CEO for HBC Promise Ghana here in Accra. There was a slide that you mentioned that there was a drop in the percentage of the government of Ghana allocation to the health sector. How is that going to affect and adjust the projections of work that you intend to do? And where would that be reflected?
Thank you.
Thank you very much. I am Emmanuel Donko, Director Administration, Tamale Teaching Hospital. My issue is to be educated on how we got data for the regions that were non-existent as of 2017 and 2018. Thank you very much.
Thank you very much. We'll take the third one. We'll have the answers, and then we'll take another round.
Thank you very much. My name is Sophonias from the World Health Organization. A couple of points may be related to data quality, if so. The first point is the family planning acceptance rate for Greater Accra region on slide 20 seems to go up and down across the years. It's quite significant. So is it a data quality issue or is that the reality? The second one, maternal mortality ratio, appears to have increased from 2020 to 2021. But I think it was labeled as a positive achievement if I don't get it wrongly. Please check it if I'm wrong, but otherwise, I think I've seen it as a positive achievement. The third point is percentage of patients encounter with antibiotics. It's changing across the years. You know, there is significant up and down of use of antibiotics across the years. But the disease epidemiology does not appear to change across the past many years. So why is that? So is it a data quality issue or what is a practice related issue? The last point is similar. The last point is similar to the first speaker, which is a kind of concern. The percentage of governments of Ghana allocation to the sector appears to have decreased from 2020 to 2021. Now, we are supposed to achieve the UHC goals in the coming couple of years and possibly build a resilient health system, learning from COVID and the plan to increase the infrastructures and human resource. So with that, the trend might be a bit concerning. What's the recommendation in the plan? Thank you very much.
Thank you. Dr. Nsian, sorry. Sorry, Eric.
Okay, thank you very much for those questions. The first question and the sixth question can be tied together and answered because they all talk about the government allocation to the health sector. Let me start on the lighter note by saying that we are all not in normal times. So if you look at the revenue to the sector, as you saw and as we've alluded to, has declined. But in the sector, we also depend on our development partners to support us in the implementation of some of the activities and programs. So even though the allocation is going down, as we saw, we hope to get support from the DPs to shore up this funding gap, if you like. So that is what I will say for now with respect to the allocation. The second question is on how did we get data for the regions that were not there in 2017? I think what the managers of the DIMS have done so far is that because the districts for the regions that were carved are known, they were able to disaggregate the data based on the districts in those newly created regions. So if you visit the DIMS database as we speak, you will see those data in those regions. And that is how we got figures for the year 2017. So my belief is that they were able to disaggregate and then get the district for the newly created regions and provide data for that. The family planning acceptance rate, as we saw, is moving up and down, especially in the Greater Accra region. The reason is not readily available, but I'm sure in the course of the discussion, the experts are here. We will get to know why we are having that fluctuation and what can we do to address that situation. The institutional maternal mortality ratio, if it was reported as improvement, then that was wrong. Yeah, so we will take a look at that. In fact, it went up, meaning that it worsens to about 119 per 100,000 live births. So that correction is being made. Thank you for that. Then antibiotics appears to go up and down. You know, the promotion of rational use of medicines. So here we are also not sure why in some years it seemed to go down and in other years it seemed to go up. But all these issues will be discussed. Then the trend, okay, so the sixth one is answered in addition to the first one. Thank you very much.
Seems we have more questions. 1, 2, 3, 4. Well, I see we have some follow-on questions. We'll take it in that order. Okay, please. Yes.
Thank you very much. My name is Saliano Hene, WHO.
Kindly speak into the microphone for us.
Okay.
We have more than 200 people online, so.
All right. Thank you very much. My name is Saliano Hene, WHO. My question has to do with denominators. So we saw that, for example, immunization, we had coverages like 122%, etc. And in the past, there's been questions about population figures. Now that we just done the census, how are we going to rectify that so that we have actual figures on the ground, even as we are talking about digitalization, so that we can actually check what is actually happening on the ground? Thank you very much. And then just a comment on the TB case detection. Usually, just doing outreach is not very cost effective. But studies have shown that when people come to the health facilities for whatever care, just doing a simple screening, as the nurse is taking vitals, asking whether a person has TB symptoms, it's a because you have a captive audience, it's a very cost-effective way of being able to detect cases with TB. Thank you.
Thank you very much. Is there a follow-up question? It's a different question. Okay, let's take that and then we'll take you. We have about 5 more to go. We still have some online, so we'll take 3 and then we'll take some online and then we'll come back.
Thank you. I'm Oswald from Coalition of NGOs in Health. Mine is a comment on the graphical presentation. If you look at the various indicators, you could see that on the y-axis, they were not starting from 0. Some were starting from 70 to, let's say, 90. In my view, it gives a different impression. For instance, if you look at the trend analysis from, let's say, 2017 and to 2021, a change may be just 1% or 2%, but because of how the graphical presentation was, if you look at it critically, one could say that there had been much of an increase, but then there may not be significant, what do you call it? They may not be significant enough. So I would suggest that if we present such, what do you call it, graph, let it start from 0 so that we can see clearly how the trend analysis has been and how significant. Other than that, it could be misrepresented. Thank you.
Thank you very much.
All right. My name is Dr. Gabriel Sechikofi. I'm a primary care physician, and I'm coming from the Private Hospital Association of Ghana. I believe the minister made certain very, very important points, which included the reporting rate from private health facilities being 14.5%. And I believe this is quite low. If we look at the other indicators, if we are to disintegrate or disaggregate the data according to the various facilities, it is very likely we will realize that that of the private hospital is something that is very unremarkable. If you look at the maternal mortality rate, the neonatal mortality rate, and all the others, if it's coming from the private sector, you realize that those rates are very, very high. I believe this is a point whereby we need to really have a look at that industrial player. I believe that for the health sector, we have the government institutions, we have the quasi, the CHAC, and the private facilities. The private facilities seems to be the second highest provider of healthcare. Just after the government. The data is there for all of us to check. But I think that our support of them is seriously on the lower side. And as a result, it seems to pull us back when it comes to our output indices. If you look at our coverage when it comes to immunization, I believe that the increment is basically coming from the fact that there has been some collaboration between the government and the private institutions. Some time ago, immunization was not being done in the private facilities. But currently, since for the past 2 years, these are being done over there, and I believe has contributed to the great increase in coverage that we are seeing. I think it's high time that the ministry gets a closer look at this and see ways and means to help the private sector so as to change this data. Thank you very much.
Thank you. So we'll round off with responses to this, and then we'll have the panel discussion. Yeah.
Okay, thank you very much for those questions. I think the first one is asking about the denominators that we use in the calculation of some of the indicators, particularly the coverage, the pentastray coverage. If you look at the target population over the years, it's based on population projections. And these ones at times seem to be, let me say that when they go to the communities to do the immunization, they end up having more people vaccinated than the projected target population. And it's something that I think the sector, the managers are all discussing it. So you saw that some of the graphs, the percentages are even over 100%, telling you that the projections or estimates that were used for the denominator, that is the target population, were more than the actual number of people who receive the vaccination. So it's something that going forward we work and correct it so that our target population will not be more than the actual population that we are supposed to give the vaccines to. I think the TB, the one on TB is a suggestion that we've taken on board, so we will not talk about that. For the graphical presentation, some did not start from zero, and we have taken note of that. But what I can say is that some of them, if you have percentage from 80% and you start from zero, it means that your graph will be up there and you have a large session on that. But we've taken note. We will work on that. So we decided to break the axis to have the graph come down. It's not deliberate that we did not start from zero. Thank you. The other one is something that I will not comment on. So support to the private facilities. I'm sure my bosses are here. They have heard you, and they will look at that. Thank you.
Please, let's do it. Let's do it good for him. He's been speaking for a very long time, and he's been the lone soldier answering all the questions that were coming following the presentation. So we want to move to the next session, and that is to have the plenary session. Our moderator for the plenary session is Prof. Richard Adanu, Director for the Ghana College of Physicians and Surgeons. So, Prof, we welcome you to. Prof will be joined by Dr. Wisdom Atiwoto, Director for Research Statistics and Information Management. He will also be joined by Dr. Patrick Kuma Abwaji, DG for Ghana Health Service. Madam Yvonne Yurinchiwa Iseku, Rector for the Ghana College of Pharmacists, will also join us. Then we have Prof. Patrick Ferdinand Ayekumi. He will also join us here. I know Prof. Cheme Etwahini was online. I'm not sure he's been able to join us in person. But if he's still online, he'll be part of this panel. So, Prof. Adanu, your panel.
Good afternoon, everyone. And this panel, as we've been told, will be discussing the holistic assessment. So each of the panel members has been called up, but there wasn't much of an introduction. So what we'll do first is that, starting from Dr. Tiwoto, I would ask each of the presenters to just give a brief introduction. I mean, you may know them, but some online and some here might not know them. So just a brief introduction of who you are, and maybe that might help us know why you were chosen to be on this panel. So, Wisdom.
My name is Wisdom Atiwoto. I work as the Director for Research, Statistics and Information Management at the Ministry of Health. And I'll be talking at looking at the data components of the holistic assessment. Thank you.
Thank you very much. I'm Dr. Patrick Kuma Abwaji, the Director General of the Ghana Health Service. I was previously with the Family Health, but I thought becoming Director General, they would relieve me of some of these technical discussions, but they don't seem to let me go, so I'm having to do both, so that's why I'm here.
Oh, okay. It looks like it. My name is Yvonne Yirinjua Iseku. I'm rector of the Ghana College of Pharmacists. I'm a pharmacist. I suppose that's why I'm here.
That's right. Patrick Ferdinand Ayekumi is my name, the former provost of the College of Health Sciences, University of Ghana. I am a microbiologist. Probably it's because of that I'm here to talk about infections. I'm not too sure, but I'm here anyway, and I'm grateful.
Okay. Right, and here we have Dr. Cheme Etwahini online. Dr. Etiahini, if you can hear me, can you please also introduce yourself, and so that they'll know that there's one of our panelists, and I'll take a note so that I don't leave you out of the questions. Dr. Etiahini.
Thank you very much, Prof. And good afternoon to you all. My name is Suimmit. I'm the Director General of Ghana AIDS Commission, and I'm happy to be with you this afternoon. Thank you. Over.
Right, thank you. So I guess I've been asked to moderate because usually when I'm a panelist, I tend to say things that cause trouble. So now I've been asked to come here to cause trouble for the other panelists. So I promise to do exactly that. So let's start. General, we've had the holistic assessment, and I'd like to ask each of our panelists, starting with Dr. Chahini, just your immediate impression about the holistic assessment. We've had a long and good presentation. What's your immediate impression about the holistic assessment? So each panelist would have a go on that, starting with Dr. Chahini.
Thank you very much, Prof. And my impression is very simple. As a country, so far as the health sector is concerned, a lot of efforts are being made. Significant achievements are being made, but there is still room for improvement. We need to double our efforts in a number of areas. But when it comes to HIV, which is my area, the indices clearly show that progress is made. And we believe that if the trajectory is to be sustained, then we will be able to achieve the 95-95 target that is spelled out in the national strategy for 2021 to 2020. So what I will say for now, Prof. Thank you.
Right, thanks. Professor Ekumi.
Right, thank you very much. Generally, I think it was a good report. We, as a nation, seem to be doing very well in some areas. There are a few areas that we need to improve our efforts. I was expecting to see a little bit more of research having been done to the data that we have. What we have is basically descriptive, and I would have expected that going on from here, we can put some of these things into models. If we can go into a bit of modeling, it will give us a fair idea of what is happening on the ground. This is basically descriptive. It tells us what the various indicators have to show. There was a second issue that I thought I should also raise. I realized there was nothing on education, health education. That was a bit of a problem to me because, you see, we can't talk about infection, we can't talk about some of these indicators unless we look at health education in one way or another, because there is a need for us to do a bit of education. People are not doing what is expected of them because it could be that they just don't know what is going on in the environment. Let me give you one simple, I may come back later on, but if we talk about the figures that we have here, how much of this is being translated into attitudinal change in the lives of the individuals? You know, because we see people spitting around all the time. We see people, you know, soiling the environment. We see people misbehaving. You know, so we have to put in education. It is very important for us. The third thing had to do with, again, involvement of other institutions. I'll take the COVID pandemic as an example, and I think Dr. Samoa Ba, talked about that. The Gucci Memorial Institute of Medical Research was very much involved in all that was done, with this COVID issue. Now, they provided data, they did a lot of research. We have to involve other agencies. We have to involve other educational and research institutions in the assessments that we do. And more seriously, we have to also remember the training institutions. I was expecting to hear something on that. Maybe it doesn't come directly under your ambit, but I think it's important that when we are looking at putting up facilities for service provision, we also look at whether those facilities are training friendly, for example. We are making changes. Are we making those changes so we are able to train our people better? Because at the end of the day, it's not the drugs. It is the service that we provide. At the end of the day, it's the behavior of the people on the ground. At the end of the day, it's the understanding that the people... I think I have to stop at this point and allow others to come in, and I'll come back again.
Okay, right. Yvonne.
Thank you very much. And I'm happy for where Dr. Ayekumi and landed, because I think it brings in one of the things that I also observed. I thought it was quite a good presentation, but I thought, for instance, that when we're talking about the healthcare professionals, it would have been good if we had an assessment of pharmacists, because we go on to talk about antimicrobial use, and pharmacists are the custodians of the medicines. As you have just mentioned, we shouldn't just be talking about having the medicines there and not talking about who is ensuring that the medicines are being used properly. So it's very important that we bring in pharmacists. And I think another thing that one of the participants mentioned earlier was the fact that we were talking about bringing in the private sector. We know that in the community, and there is a lot of research to support that in the community, over 75% of community members, if there is a pharmacy available, will go to the pharmacy first when they are not feeling well, and then subsequently go to the hospital. But it appears we do not incorporate that data into the national picture. What is happening there? Are these facilities equipped to provide the service? Which also brings me to looking at TB, for instance, and looking at, for instance, the suggestion that was made. These are facilities that are always available. The community members can just walk in without appointments. Is it possible for us to strengthen these facilities so that these NCDs or even infectious conditions are caught very early, and we don't wait until we get to the point where there are major issues and treatment becomes a big problem before we get there? And I also agree that the training, I know that it is part of the assessment, but I think capturing it here would have been good, talking about the training institutions and how they contribute, even the details of ensuring that the personnel are being trained. Are we meeting our targets? What are the targets that were set? How can we be supported to provide those services properly? I think these were things that we could have captured in the report. Having said that, I think the ones which were captured were well presented and they were clear. We can see the trends and see how we are doing and how in some instances we are not doing well at all. Yes, so I'll also stop here and let others come in. Thank you.
Okay, thank you. So we'll move on to Dr. Chiwoto. What's your immediate impression about the report? Then we'll end with the Director General.
Thank you very much. Thank you very much, Prof. I think the presentation was good. The good news is that most of the data came from the DHIS platform, what we call the DIMS platform, the Ghana Health Service. That contains data from the GHS and all other service providers, except a few. But clearly, we realize that it's not all the indicators that can be, whose data needs can be addressed by the data from the DIMS. So the question is, how do we bring these data, other data sources onto the platform? Some of them require surveys, like the demographic and health surveys. That takes about 5 years to be done. What it means is that between those periods that it is done, we cannot compare. And that is a bit problematic. There's also research data being kept at Ghana Health Service research centers and then universities and other interested parties. How do we bring all these data sources on board to truly undertake what we are calling a holistic assessment? These are very critical questions that are lingering on my mind as the director of research, and I'm sure moving forward, these are areas where we want to focus our attention to make the whole exercise truly holistic. Thank you very much.
Thank you. Before Dr. Baji comes in, it is my job to ask questions. And we're having the panelists asking questions. They should prepare to answer those questions before we leave. So, Dr. Baji, this is just to warn you that be careful about the questions that you ask.
Prof, thank you. I'll make sure I make recommendations, not questions. But I think the presentation was excellent, very detailed, and I'm really happy with what Dr. Nsiah did. And I also think that the performance for the year is very, very good. Looking at what we had to go through, it's very easy for all of us to forget where we have come from. In 2020, that's the year that we are comparing with, we had a lockdown, we had one wave, and a third wave, which I call the panic wave, that affected essential services. In 2021, we had the Alpha, we have Delta wave, and then the end towards December, we had Omicron, and what we forget is the fact that was the very year also had yellow fever outbreaks. And so obviously it will affect performance. So even what we have been achieved for us is something that we never thought we could even get there. And so that means that the 2020 panic, that helped us to put in system to improve our essential services, became supportive during 2021. Otherwise our performance would have been very, very, but that is my first take on the overall performance. And so you have to congratulate the team for the hard work, both public, private, charity, for the work that they've done, even under those circumstances. When it comes to the objective one, which is my area of where we have an interest, is the OPD per capita also showed, if you look at the breakdown, showed the fact that the new regions had a problem. Northeast, OT, Savannah, etc. Of course, Bono did well because they were all the problem regions, districts were taken away from them. And so now their performance goes up. So Bono East is taken off, Ahafo is taken off, so it's the big guys in the middle there. So you see that they will perform. But that is the rationale for getting those regions, to those districts to improve. And of course, because we didn't divide districts, it was very easy to do their analysis based on the very districts that were carved out. So you can still generate report, and we've been generating report for those regions since 2020. The issue of the OPD, the NHI, is also important. What we are also looking at is the fact that we must also take cognizance of that if access to care is poor, NHI utilization will also be out. Even people, if you don't have hospital, why do you go and get a card in the first place? So these are all issues that we need to talk about. And I think we will, as we go forward, we'll look at more details. But in terms of what we can add, as the previous speakers have spoken about, is for me, is how do we look at how do we add budget performance to this indicator? We talked about the cut. What proportion was put on our priorities? These are important questions that we need to also assess to make sure it's a 360 assessment. the infrastructure development. How do we access it? If if it takes them 15 years to finish maternity for Dr. Heneba Danso, how do you expect him to reduce maternal mortality? These are all areas that we need to look at that. And I've mentioned the denominator issue. It's a big issue because as at the end of 2021, the projected population was nearly 33 million. The same year census gave us 30.5 million. So what, are we performing better? Are we gone down? If you look at the proportion, these are all questions that I think we need to look at. Thank you very much for that.
Right, thank you. So we'll move on. Maybe picking up on the denominator issue. I'll just make a comment. I mean, Dr. Ohene made that suggestion that what we probably need to do to make sure that we are getting the right things is that now that we have the actual populations, to kind of like redo these numbers. But the problem is that after a health summit and after all the fanfare, there seems not to be much motivation to redo the numbers. So the chief director is here. So I'm passing on the chief director to make sure that Dr. Adami and his team redo these numbers so that we know what it is based on the actual population. I think that was what Dr. Ohene was saying, and Dr. What's Eric's full name even? He nicely dodged it, but I've kind of like put it back on him that he should get that work done. So back to the report, and I'll start with you, Patrick. Pick one area with not so good performance. And if you don't pick the right one, I'll tell you the one to pick, because I know what you should be picking. Pick one area with not so good performance and let us know what your thoughts are about the reason behind the not so good performance. So that's what each of the panelists is going to do. So, Patrick.
Yeah, I think I'll pick the morbidities and mortality area. And I think those were areas that we felt that there was a problem in mortality data. Under 5 mortality went up, maternal mortality went up, and a few areas. These are areas we need to look at. We've had a lot of inputs in terms of human resource. 51,000 recruitments in the last few years. The question is, where are they? Are they at the places where they are supposed to be? And I think that is what is creating some of the challenges that we need to look at. But when it comes to the maternal mortality, I've been not too worried because there are few facilities that cause that problem and we can fix it. A large number of regions recorded a decline. But you see, there are 2 regions that account for almost 50% of all the deaths in Ghana, maternal deaths in Ghana. When they shake, the whole figure distorts. So it's quite easy to get in there and have that addressed. And so I'm not too worried. I'm also reiterating what Dr. Nsiamboatin tried to allege, that I said maternal mortality will go up. I said neonatal mortality will continue to go up until it stabilizes because there's been a lot of underreporting. But now we have about 85% of all our babies born in hospital. There's a lot of access to newborn care. People are coming for postnatal care a lot, and so the newborn deaths are getting reported. Previously, we are not. Because if you do survey, you get 25. And then we do institutional data, say it's 6. Definitely something is wrong. And so when it starts appreciating, I believe I'm a bit confident at least we are getting the right data. But I think the item 1 and 2 has a way to play in the mortalities. And I think those are areas that the under 5, we need to continue to take a look at them. And I think from the data side, we need to look more also at the absolute numbers. Because beyond the population decline, Prof, is also the under 1. The new census says is 2.4%. That's, if you look at the absolute numbers and you put that denominator, you are doing 150%. So those are areas we have engaged statistical service to see how do we redefine and get those figures correct. because under 5 figure is too low for the absolute numbers. We are saying that if you say 2.5 is for Greater Accra, we want to use the same for Northern Region. When total fertility rate in Northern Region is about double the fertility rate in Accra, how do you use the same proportion? These are questions we need to start asking to look at that. But I think there's a lot we can do in terms of that area, not necessarily on training, but also getting the necessary infrastructure in some of the regions who are showing increasing trends. Because when the COVID came, if you look at the details, you can see all those fragile regions started recording increasing mobility because their ability to absorb is low. And I think that's an area we need to really take a cue at, Prof. So I will end here.
Okay. All right, thanks. Yvonne, what are your thoughts?
Thank you very much. I will look at antimicrobial, the antibiotic use. And I'll say that I know that there are quite a number of facilities which over the last few years have been building capacity in antimicrobial stewardship, including some teaching hospitals. And I believe that is the way to go, to get the institutions to look at antimicrobial stewardship, look at delayed prescribing, ensure that we are testing before prescribing, getting the results before prescribing. And if we continually inculcate these activities and attitudes in our healthcare professionals, I believe that we should be able to control the use of antibiotics. But we shouldn't leave it there. It is very important that we also engage community members to understand that it is not everything that requires antibiotic use. And once we do that kind of engagement, get the community members to understand it, and they reduce the pressure that they put on prescribers for antibiotics to be prescribed for them, I believe we will be working towards controlling the use of antibiotics. But having said all of that, I come back to my original statement that it is important that when we are doing these assessments, it is important that we look at the community pharmacists, the community pharmacy, and look at how they engage with the community members and see how we can build capacity in those areas to ensure that these targets that we are setting for ourselves, trying to reduce antibiotic use, will be met as a lot more community members and a lot more community pharmacists. And even when we do our assessments, look at how the pharmacist to population ratio, for instance, and look at how that impacts on the use of our medicines. Look at how that impacts not only on antibiotic use, but on rational use of medicines generally. I believe that these activities will go a long way to help in that direction. Thank you.
All right, thank you. So, Chairman, if you thought I'd forgotten about you, haven't. So why don't you come in now and let us know one area that did not perform well? And you've basically spoiled your case by saying that HIV is doing very well. So now you have to stray out of your comfort zone. So, Dr. Tuahini, let's hear you. One area without good performance and what you think is the reason why they didn't do as well as HIV.
Thank you very much, Prof. I think one area that is of interest to me is uptake of family planning services. We saw that in many of the regions, use of family planning is quite low. And I would want to relate it particularly to young people, because last year, the Ghana Health Service reported that about 500,000 cases of teen pregnancy in the country, which means that if we we are giving some attention to adolescents and young women in the country so far as family planning is concerned, we would have prevented this number of large young people or females getting pregnant. And I relate it to HIV because 28% of new infections were accounted for by young people between ages 15 to 24 last year, in 2020. And so that shows that the almost a third of new infections coming from young people is a matter of concern. And you can relate it to teen pregnancy, which suggests that these girls who got pregnant actually had unprotected sex. And what does that mean for HIV? In actual fact, the more than 5,000 young people aged 15 to 24 who were newly infected in 2020, 83% of them were females. So you can, anecdotally draw some inference. And therefore, we need to support young people. We have adolescent-friendly clinics all over the country. And the question is, how are services in these clinics being accessed by adolescent girls and young women? I think particular attention should be paid to this. You wanted me to talk about just one, but
no, you stay with one. I mean, you are supposed to answer the exam question exactly. Otherwise, you have marks deducted. So maybe to correct a number, Dr. Boaji was about to have an eclamptic fit when you mentioned 500,000 teenage pregnancies. So, Patrick, what's the actual number?
Yeah, thank you. It's usually about 12% of the total population of pregnant women, and we are looking at about 900,000 reporting. So it's around 90 to 100. I don't have the exact figure, but it's about 90 to 100,000. That includes the 19-year-olds who, by law, they are allowed to get pregnant and marry.
So the adolescent pregnancies were about 90 to 100,000. That's what he's saying. But it's still an issue. And you see, when it comes to family planning, I mean, like Chairman did, I'm supposed to be a moderator, but then I can't help but make comments. Sorry. We always like to point fingers at the younger people and all that. And I'm not that old now. In my younger days, when the crowd was also people who were mostly target group people, I was tempted to do something. I'm still tempted to do it, but I'm not going to do it. But I'm asking, maybe if we ask show by hand, who here, I mean, counting yourself and your partner as one, using contraception, we might just begin to understand why the problem exists in this country. You understand? Some people are saying that don't ask us. Yeah, I'm not going to ask you, but sometimes that's where the problem is, because one of the biggest things that we haven't been able to hit from the MDG days is family planning. And maybe there's something about our mindset as a people that really affects this. I mean, you see Ghana's low family planning user rate, and then you see also we report low complications to abortions and all that. Then it's like, so what's really happening? How are they not getting pregnant? And Alan Hill, my demographer friend, said that they hold their breath when they're having sex. maybe that's why. Okay, where do so Chairman, yes, second Patrick 2. Let's hear from you. What is one area that's with not so good performance, and what do you think is the reason behind that?
Well, I think I'll go to my own area, the area of infection control. I believe we just looked at one small area, surgical site infections. What about what goes on in the other areas, the wards, the emergency centers, the NICU, and other areas? if we should, have data from those areas, we can see that we probably might not be doing as well as we think. It's very important that we go back to check on these areas again. And with infection, as I've said, we should not just look at what happens in the hospitals, because it's coming from the environment to the hospitals. And we are taking them from the hospitals back into the environment. And it is important for us, for example, to make sure that the information you presented, we disseminate it. It's one big issue that we have. People don't know what is going on. In the training institutions, for example, do we get access to some of these things to guide us in our delivery? Do we get access to some of these informations to guide, our training of the professionals, healthcare delivery and all that? No, there's a need for us to know what is going on. We're looking at malaria. Malaria is going up, it comes down, it goes up again. Why? Because there is a problem in the environment. So we can't just take health assessments in isolation. We have to look at it holistically. What is causing this? A little bit is coming from the environment. A little bit is coming from the institutions as well. And some portions of that could be traced to the personnel as well. So infection control, are we following the protocols in the hospitals? Are we following the guidelines? Are we doing what is expected of us? I believe those are areas that we should be looking at. And you see, every one of us in this room should help us to solve this problem. Every one of us here. And I often talk about attitudinal change. You go to our washrooms, and you can see that we can pick infections from there to our homes. People wee onto the floor, and people step in and take them home. If you capture this, if you want to capture this on your radar, you won't get it. It's an attitudinal change, which we should have. So again, infection control. Your data says that we are doing well, but I think that we are not. Because we are looking at a very small area. We should look at the broader view and picture of what goes on in the community. Thank you very much.
Right, thank you. So what Professor Ekumi is saying is that some of the things might not be looking as good as they are. But then I guess the reason is probably linked to what Dr. Tiwoto said, that these figures presented are not survey figures. It's not a survey of the whole population. These are figures that are coming from our health institutions, saying that this is how we are performing. But that doesn't take away from what he's saying, that it's important for us to also work a system in place such that we are tracking the survey things, and we don't kind of like present things that are looking good only for a survey to appear and the figures are all up in the wrong direction. I think that's the point that he's making. So we should look at it that way. So Dr. Tiwoto, one area with not so good performance, and what do you think?
So I would like to look at broad objective 3. If you look at objective 2, the performance was 3.2 on a scale of 5. Going down, you see that there were a lot of inputs. The health workforce increased by over 26,000. There were increases in the health insurance coverage. So that means a lot of people who go to the hospitals. There were, I think, increases in bed capacity and all that. But if you look at objective 2, we had 2.6. The presenter said some of the data were not available. But if you look at objective 3, that could probably explain what we found out in objective 1. The fact is that the efficiency in governance and management has gapped. That's about 2.4 from what I picked from the discussions. So we need to throw more light there. What are the systems we have in place? We have deployed a lot of systems to capture service data, but our work input, we are not tracking them. We don't know if meetings are being held on time, if outreaches are going on as scheduled. We don't know all these. I'll still get back to my original position that we need more insight. We need to look at what is happening there. We need to look at the research, look at the operational efficiencies, even clinical governance. We need to look at all these. Other areas we can also look at is the guidelines compliance and all that. So for me, that is my main area of concern. We need to throw more light in that area, objective 3. Even though this is the end of this in the objectives for assessment for this year, moving to the next medium term, we need to look at how some critical components of these objectives can be captured and then track moving forward. Thank you.
Thank you. So that raises a question, because like you rightly said, like Eric said in his presentation, this is marking the end of this cycle, isn't it? And it might have been good to have an idea of what about those things we did not achieve, because it's sad to see that at the end of the cycle, there are some milestones that are still scoring -2. And the question is that, so what are we doing with those milestones? Are we stopping and just kind of like finding some new thing to jump on? Or are we going to work this into it? Why did that happen? But well, not everything was bad. I mean, there were some good things in the report. So let's not dampen the spirit of those who are working hard and presenting this data. So let's each talk about one thing that did very well. One thing that did that with good performance. And why do you think we're able to achieve this good performance? Yvonne, could I start with you?
I captured something that I wanted to talk about if I had the opportunity to talk about the one good thing.
And for information, they didn't see these questions beforehand. This is pure exam conditions. Yeah, Yvonne, so go.
Yes, I thought one good thing that I saw, of course, it was explained by our presenter, the emergency response. I thought it was great, and also to see that even though some areas had very long response times, we could actually understand why that was the case. Because if somebody is going from Western North and the referral facility is Komfo-Anokye, it is understandable that they will take a long time in dealing with that. And I think building on that, we have to make sure that we use our emergency services properly. So perhaps as we are talking about Agenda 111, there will be areas where we want to focus to bring the infrastructure closer to the people so that we can even make better use of these facilities that we have. But I believe one of the challenges with the ambulance service is also the fact that even though the ambulances are available, there is the issue of recurrent expenditure and maintenance and all of that. So I believe in that case, we are then talking about our budgetary allocation to the ministry and looking at how feasible it is to ensure that these facilities are maintained so that we can see continuous improvement in this area. Thank you.
Thank you. So Director General, all your staff are online. So, and you contribute the biggest chunk of this data. So what is it that has been good? Why has it been good? And then you can give congratulations and Director General awards at this time.
Thank you, Prof. I think that's a very, very difficult area to pick, especially if you want to look at the objective, because there are good ones in some objectives and there are some bad ones in the same objective. But I believe that maybe let me just comment on API and the way And at EPI coverage, has been very good despite the challenges that she's gone through. But this tells you that where there are systems built over the years and they have been sustained and they have been improved, it becomes a second nature. You have a system where everybody is involved. It also helps to work out, even in the times of crisis. And I believe these are very, very important lessons that we can look at, and most importantly, when it is funded. Okay, because funding makes a big difference. So the funding, the commitment of leadership, and the broad spectrum of team being involved at all levels, and also having existing systems that have been put in place to ensure that these things happen all the time. Not just the program, from the partners who support it, to service provider, leadership at the ministry, Gavi, etc. These are all things that helps to make sure that these things do work. And I believe that these are some of the elements that we need to bring to bear on everything. Instead of, you mentioned something, the things we have not achieved. Now that we have new objectives, what are we going to do with them? Are we still going to develop the referral policy or not? Are we going to, these are all areas that we need to have some sustained effort to build them up. And I think I wouldn't want to say you have done so well, but these are ingredients of success. And I think we must look at it and implement it across in all the other areas. Thank you.
Okay, so to interpret what the Director General said. The Director General is saying to the public health nurses, community health nurses, and all those out there who are working on the EPI that you are doing very, very well. Continue doing well. He's saying a big thank you to the donors who are supporting this system and the leadership behind the immunization thing. That's what we were saying, wasn't it? That you are doing very, very well, and you should keep it up. And then we should all learn from that system, because the system has been doing well for very long, hasn't it? And there's probably something there that causes it to do well. You know what it is? It's the high proportion of nurses to doctors. There are very few doctors in that field. When you put 2 or 3 doctors together, the book long stops the thing from working. So congratulations to our nurses. The doctors are going to come and learn from you. You know, the nursing field is military. It's military. What they say, when the boss says do this, you just go and do it. Doctors, Director General says do this, and you say, why should I? We are all going to learn from the nurses and get. That's what we were saying, wasn't it? Okay, good. So, the doctors are leaders. We'll discuss that later. No, the nurses are leading strongly from behind. Right, Professor Ekumi.
I think we have to mention the other health professionals as well. Yes. They are also doing very well. I was expecting to see some data on that, but unfortunately I didn't get to see it. Maybe in our next presentation it would be a good idea for us to capture something to make them also a bit more recognized. Thank you very much. But let me commend you for the collaborations that we have with the other agencies in rolling out your engagements and programs. I think it's a wonderful and laudable thing, and I commend the ministry for doing that, and pray that we'll be able to extend it to cover other, institutes that are in the local environment as well. Right, thank you very much.
Okay, so the collaborations, the partnerships are yes. Great things out there. Dr. Tioto, you haven't talked yet about the good thing, have you? No. So please do that, then we'll go to Dr. Treme.
Okay, so
Dr. Ituahini.
I would like to talk about the number of facilities reports on the DIMS platform. Even though we are looking at just reporting, it's also a progress indicator of how digital health tools are being adopted across the health system. And we all know the benefits of deploying digital health tools. So it's something that we need to study and see what is making it work. I believe there's strong leadership, but there could be other factors too. We'll look at that, and then we'll see how we can leverage these to move the digital health agenda fast forward. Basically, we can learn from that, and then maybe with that, we can assess the challenges that we have been facing with quality. Dr. Nsia mentioned some issues on quality, timeliness, and then completeness. Once we are in that trajectory, we should be able to look at all the factors at play and then close the gap so that we can have complete reporting. Thank you very much, Prof.
Right. Dr. Chuaini, one good thing and why it's happened. So you can take your HIV, because I know that's what you're going to say, that HIV has done well. Tell us why it happened, apart from saying that it's because you are Director General. If you say that, we'll pass through the virtual thing and come at you. Okay, so one good thing and why that has happened. Dr. Chuaini, can you hear me? Yeah, I think you are muted. You are muted. Chairman, have you unmuted? Just unmute and start speaking. Or have we muted him centrally? What just happened? Yes, so Chairman, please speak and let's see whether we can hear you. Or he can't hear me now. He can hear me. Yvonne just lip read, but good, good.
Yeah, thank you. I think one of the things that I believe is going well is we have seen the funding situation. Government per capita spending is gone up. We've seen that the NHIS enrollment is also gone up, although still below 60%. And per capita spending is going up and still below what other countries are spending. And obviously, we also see that the government contribution is gone down to 5%, a little more than 5%, which is far below the 15% ECOWAS requirement. And so we need to see how this can be addressed, because although our donors are supporting us, for which we are very grateful, the current funding architecture or dynamics are changing. And so governments are being asked to, raise more domestic funding to support health, to finance health activities. And so we should be looking at that aspect as well as a country. And it's also from the report to show that between 20 to 30% of revenues to NHIA are not available for use. It would have been useful highlighting how that amount of money or where that amount of money is going. Because we are, again, I would like to relate it to HIV, because we have a situation where HIV services are free under the treatment policy. Anyone who has HIV, who is on national health insurance, should receive the full range of HIV services for free. However, because of delayed payment by NHIA to service providers, some health facilities are compelled to charge persons living with HIV for laboratory and other services in health facilities. And for many of them, they are experiencing catastrophic health expenditure, which is resulting in loss to follow-up. And so user fees is actually very high when we look at the HIV expenditure figures. And so we need to look at that aspect as well and make national health insurance more functional in meeting the health needs of its members. Thank you, Prof. Over.
Right. You see how difficult it is to commend people. I mean, every commendation that has been made, almost every commendation that has been made, there is something about, but this is not going well, but that is not going well. I think we should learn to commend people and then keep the bad news for another time when I die. Then that's bad news. But then some things are going well. Not everything is going well, but when we are talking about things that are going well, let's just stick with the things that are going well, so that people would be encouraged about that. Don't be like what you do to your children. Your child is always like 20 out of 25 in class. Then next time the child comes and the child is fifth, then you say, okay, you've done well, but why were you not first? I mean, that's the typical African parent. We mustn't do that to our children. So things are going well, and there's some things we're happy about. Let's keep doing those things, and let's learn from those things that are going well, and that might help us turn around the things that are going poorly. I think we've gone kind of like beyond our time now, but this panel was brought late. If I was going to stay on for the whole 1 hour something, then we'll leave at 3, isn't it? I mean, and there's a lot we can talk about till 3. MC, should I continue till 3? You cut my time with all those questions. This is my moment of glory, and you want me to cut it short. Okay, we're going to end it now. So, panelists, let's get some closing remarks. Let's get some closing remarks from our panelists. This holistic assessment is a good thing. It gives us an idea of where we are. Certain statements were said at the beginning. We've got to get training institutions into this. We've got to get it to reflect other cadres of health workers. We've got to get more data coming in, more people reporting to get this going. And I am primarily from a training institution, and one thing I would say is that people from, and this holding brief for Ghana Health Service and Ministry of Health, but it's a thing that I came to learn. People from training institutions are drawn into developing these documents, the assessments, writing the policy guides. When you look at the contributors, I mean, the ministry and the Ghana Health Service actually value academia. I mean, they come in and they contribute to doing it all. But then when we go back to teach, we don't use these guidelines. And some of our students, when they graduate, the first place that they see standard treatment guidelines is in some consulting room. Calm down. That's the first place they see standard treatment guidelines. They've gone through all the things and all the teaching and whatever. They've seen the Nelsons, they've seen the Harrisons, they've seen the Kuma and Clarks, but standard treatment guidelines, which their teachers contributed to drawing, they see the first time when they are posted out of the teaching hospital and they are wondering, what animal is this? You understand? So there are some things that we all need to do better in terms of collaborating. Health, there are so many facets to health. And we all need to put our hands to it and make sure that we are getting it. So that's my 5 seconds of fame. So whoever is capturing, make sure this one gets captured. Adanu says everybody should work together to get it to work. You can forget what everybody else has said. So let's go back to our panelists. Chairman, we'll start with you. Closing remarks, short closing remarks. Dr. Samaba has to move. He's described me sometimes as a nomad. Today I've got him. I've got the mic, and as I've listened to him speak many times, and I'm telling you that Chris Rock has a major challenger in Ghana. I'm going to be his promoter, and Chris Rock will be down. So let's go, Chairman. Closing remarks.
Thank you, Prof. Yes, I think the report is well done. It's giving us a comprehensive view of what the health situation in the country and service provision are going, and therefore the collaboration that is required to ensure that we move to the next level should be strengthened, especially with non-state actors like NGOs. They should have a place in healthcare delivery, especially at the community level. We need to have that kind of synergy between the community level and health facilities to actually ensure that we are able to link up patients to services and make life easier for everyone. I'm happy about the collaboration between GPs and the government as well as NGOs. And we need to capitalize on this strength to strengthen health information, health management information systems, especially in building capacity and empowering healthcare workers to take responsibility and ownership for data capture, management, and use in the facilities, as well as the hierarchy, across the hierarchy of health system. Thank you, and over, Prof.
Thank you. Professor Ekumi, closing remarks.
Right, thank you very much. I think it's been a good report. We have recorded a lot of achievements. It is my prayer that we'll be able to sustain, what we have been able to achieve so far. And finally, let me say that what we have achieved, it is my hope that we'll translate all that into attitudinal change in our, individual communities where we find ourselves. Thank you very much.
Thank you. Yvonne.
Thank you very much. And I'll also say that it's a good report. It gives relevant information. And add that I think it is important that when, as a ministry, we put structures in place, we utilize those structures. And I'll just use one example and say, for instance, our national platform on antimicrobial resistance is doing a lot of work, collaborating with a lot of bodies. But I think sometimes there is the need for these bodies, for instance, to be resourced so that what it is that they do can reflect broadly in the work that we do. But the report, I think, gives very relevant information. Thank you.
Thank you. Wisdom.
I think this is a good report. It's quite comprehensive. What we would like to do moving forward is to make this available on a shared platform so that everybody can access and question and raise further questions for which they can undertake research to answer them. Moving forward, that should be the direction. Increase sharing, increase visualization, and then we can make some progress from there. Thank you very much.
Right, Patrick.
Yeah, thank you, Prof. I think our time has been cut short, but it's fine. But in my closing remarks, I think a lot has taken place. I agree with the collaboration, which is extremely important. But I think we also need to scale up our primary healthcare service, especially the team is UHC. And I believe that the issue of creating the network of practice at the primary level is something that we must really take it forward to give access to everybody. We need to also scale up ICT in all our care. We cannot continue developing building structures and facility, but I think with ICT, we can still be able to do more with the few facilities that are available. I think that's an area we need to ensure that our referral and gatekeeper system works very well. And that will work if the primary level is protected, if the Heneba makes sure that in King Council and all those surrounding areas are adequately covered so that we don't refer cases when they're about to die to them. And I think that is extremely important. That's part of the gatekeeper. If you just keep the gate, they will break the door and come in and die, and you'll have high public. And I think we need to continue with the lessons of the public-private sector. Collaboration is extremely important. We don't seem to trust each other. We must learn to trust. The public sector doesn't trust the private doesn't trust and of course the CSOs also don't want to trust anybody.
And we all don't trust the government.
They don't trust anybody, but I think we must learn to trust each other to look at that. But the one area probably we must look at is the rapid urbanization. Now we have 50-50, rural, urban. The problem is the rural, urban poor. That is where it's difficult to see them. With all the good work API is doing, the problem they have is the urban poor. If you look at their data in Accra Metro, it's 50% because they can't find those kids. How do we use technology or our system to reach out to the urban poor? Because it's growing and it's going to grow now. I'm sure in 5 years there will be 60% urban and 40% rural. So we need to now start focusing on that and make sure that, because obviously the current chip system that works in the rural area will not work in Fadama, will not work in other places. We need to find other ways of addressing some of these areas. Care for the aged is something we must start looking at, Prof. You see, the current census, almost 1 million people in this country are over 65 and above. 1 million. And so that is not a group we can ignore. We need to start doing something for the aged. And on the demand side, Prof, I agree with you. The attitude is important, and we ask that maybe we must also get into that side. Should health insurance not be supporting some health promotion activities so that the sickness or the illness will go down? So these are some of the key areas that I believe that we must look for in the next generation of the new current program of work, that we must ensure that if we do these things, we would have covered most of the challenges we have. Thank you very much.
So thank you to all the panelists, and thank you to you all for being a great audience. And the only person I'm not thanking is the MC who took away our time and all the plenty things we had written to say we couldn't say. So MC, when you see me in the street, run. Thank you very much.
Thank you very much, Prof. Adano. My spikes are in my bag, so I'm going to wear them right after here. Thank you very much. Thank you for the great moderation, Prof, for the plenary session. I want to turn attention online to acknowledge some of our guests online who gave us some thought-provoking questions. They have had some answers online through the chat box as well, but we feel that it's worth that we recognize them. Dr. Linda Vano to kindly take over.
Thank you very much. Oh, the discussions went so well. Some of us wish we were there because those online could not add their voices physically. So I would like to just share some of the things that they have put down. And doing that, we want to acknowledge the fact that from the discussions that went on, I'm sure all of us appreciate the need to bring on a group of people to think about health and not just the health sector. And it's good that the health sector is reviewing the next tool for the holistic assessment. So from the GEG, Ghana Health Service Authority, is saying that the MNE portion is also very important. And some of the things that have been discussed so far will be looked at. There's a need to incorporate some of these into the new one that will be developed. From the academic institutions, we realize that it's important to also bring them early on so that some of the things that are identified can actually be investigated to find out why these have happened, just as Dr. Tuwuko said. So I'm sure that Professor Evelyn Ansa, being from the UHAS, is also online and they are also listening. A lot has been said about the maternal and newborn stillbirth and all that. And we are happy that Dr. Kokisa, the Director of Family Health, is also online and they are all taking note. I don't know whether they tried meeting is on, but yeah, Dr. Treme and I believe Dr. Isi, if it's on, we are having questions about why is it that we are shifting to clinical? Why is it that we are moving from the ABC slogan on HIV prevention and focusing primarily on treatment? So this is something that I believe they can think through, and maybe we can have some answers either tomorrow or going on in the future. Dr. Cynthia Bannerman was asking about what happens to the 30% or so of the money from the NHI. Where does it go to? How is it spent? And then somebody also wanted to know about how are we looking at these indicators. Dr. Erasmus Agongo is looking at the fact that some of these indicators might actually be redundant. So there'll be the need to review them properly and see which of these indicators still have to be there going forward, because that will help us to look at what is happening without looking at indicators that will not help us going forward. He says, for example, that in Accra and probably in other places, there's the no bed syndrome. So if you're talking about bed occupancy, how are these two linking up together? Ladies and gentlemen, those of us online have also enjoyed the session. For my own self, I think that there's a lot more that can be done going forward, and we need everybody's step. But it has been a very good presentation showing us how the health sector is performing, and this is good to take us forward. And on that note, I will hand over back to Kwame to take us to the next item on the agenda. Kwame, over to you.
Thank you very much, Dr. Vanutu. I call upon the Director, PPME, Dr. Odami, to give us a wrap-up for today.
So thank you so much, Mr. Kwame there and Dr. Vanutu QMC. Yeah. No, I think a lot has been said today. The moderator has changed, but I think some key things have come up. They need to review the two. And the good news is that this forms the last year of the last health sector medium-term development plan. So clearly, we are going to have that review going to happen, where we are all going to sit down as part of the new health sector medium-term development plan, which commences this year. But we also have to be cognizant of the fact that not everything can be put on the two, because definitely we have to agree on what comes on the two and what will not be on the two. So that's why we need your collective wisdom in deciding what we put on the two, what we agree upon as milestones. But in doing that, let's also not lose sight of certain key things that should happen. Though the objectives have changed, most of the strategies still capture a lot of the things which are already there. So if you look at the referral policy like this, the process is ongoing. A lot of the other key strategies are within the last health sector medium-term development plan. Some have been translated into the new health sector medium development plan, though under different objectives. So let's lose sight that we will not lose sight of a lot of the key things that we're going to do. But those meetings will be held in such a way that our training institutions, our service delivery organizations, our regulatory institutions are all part of the thinking in agreeing upon what we will all agree upon together. And I think one key thing to that has come up is the fact that we can do business as usual with some of the indicators we've seen. And like the DG said, we need to look at the design thinking in terms of the network of parties and that design thinking we will have to look at in accordance with also the referral and gatekeeper systems. I think one key thing that's also happened is the fact that we are seeing data in terms of bad outcomes in our urban points. And like the DG said, urban health is coming up very strongly. In fact, if you look at immunization, though we've done so well, but the worst place have been in the urban areas, Greater Accra. Not just immunization, our neonatal mortality rate, our maternal mortality rate, even our uptake of NHIS enrollment in the Greater Accra region is not too good. So really, the whole issue around urban health will have to be investigated quite well. And maybe one size fits all might not work. Like the D said, chiefs in the urban area will have to be thought through in terms of what we have to do. I'm just opposing this with the latest census we also had. Because the last two censuses, Eastern region was the region with the highest population. The penultimate one before this current one, it was Ashanti region. This current census is Greater Accra region. So you see the human drift. I always say migration has been part of the human race because some of us came from Sudan, some say Israel. But clearly people are drifting towards the Greater Accra region. The other interesting part about this latest census is also the fact that Greater Accra, Eastern, Ashanti, and Central constitute about 54% of the population. 4 regions out of 16 constitute more than half of the population. So clearly, the future is going to urbanization. But I think the challenge will be that it will not be urbanization as we are saying it. Maybe the right word might be Islamization. Because most of those people moving from those villages coming to Accra will not live in the 21st century houses in East Legon and airport residential area. If you look at the censuses again, the number of people who are living in kiosks, in front of kiosks, have increased. Temporary shelters in Greater Accra and Ashanti. So this is a huge challenge that confronts us, and I think it's something we may really need to think about urban health going into the future and how we confront it. Then the other issue that also came out strongly is that the future of health might be non-health, how we can work with other sectors outside the health sector to see how collaboratively we can work together with other non-health actors in getting things done, and also looking at the illness. Last but not least, the whole area of IT and how we look at the IT revolution in the light of our current thinking. So these are a few of the things that have come up, and we want to really thank the presenters, the presenter, Dr. Nsia Boateng, for a very lucid presentation, all the panelists for well thought out remarks that came out, and we'll take it from there. So once again, thank you so much, and over to you, Mr. MC.
Thank you very much, Dr. Odami. So all too soon, we are at the end of the day's program. But before we go, hopefully tomorrow, the highlight will be on the theme for this whole 3-day summit that we have, strengthening our health information systems for tracking universal health coverage. So tomorrow, God willing, we are going to have 3 presentations. We'll have a presentation on global perspective on health information systems. We'll have a presentation on the draft health information system strategy. And then we'll have reflections on the e-health system. Then we'll have 2 panel discussions tomorrow. So tomorrow we'll have a lot more talk and discussions on ideas as we look at finalizing this strategy and implementing it to lead us as we go on our path for universal health coverage. We'll also have another discussion on interoperability, God willing, tomorrow. So I want to say a big thank you to everybody for making time and sticking with us throughout, especially those online as well as those who are here with us. God willing, tomorrow, we hope that you would be with us throughout the period from, we're arriving at 8:30, and we are closing about the same time at 3:30. I think we are doing good with our closing time today. We probably would give applause to ourselves for being able to manage both our questions and our discussions to enable us to go early. I know I owed Prof. Adano. We'll see how we'll pay that one. We'll pay that one off. So thank you, everybody. Lunch will be served on the 8th floor, so we'll all go to the 8th floor. It's packed lunch. If you want to sit and eat, you can sit and eat. If you want to carry on, you can carry on as well. So thank you very much. So I'm informed that if you don't want to go to the 8th floor, we'll bring some of the packages down here into the auditorium, and then you can have it as well. So we'll note the numbers, and then we'll bring some down as well. I want to invite Dr. and Mrs. Anastasia Yurinchi, Director for TAMD, to give us a closing prayer.
Thank you so much. On behalf of the Minister for Health, Honorable Kwekurajima Menu, and the Presbytery of the Health Sector, I want you to stand on your feet, please. Please kindly join me as we sing this song, and I will say the closing prayer. Captain of Israel's host. Captain of Israel's host and guide of all who seek the land above, beneath thy shadow we abide, the clouds of thy protecting love. Our strength, thy grace, our rule, thy word, our end, the glory of thee. Father, we want to thank you one more time that you came with us. When we called upon you from the beginning, you've been with us. What a friend we have in Jesus. All our worries, all our anxieties, all our difficulties and challenges to care. What a privilege to carry everything to God in prayer. Father, we call upon you one more time that the health of the people of Ghana is still in your hands. As you said in your word in John 3, verse 1, you said, you wish that above all things we prosper and be in good health, even as our soul prospereth. Therefore, Lord, we have gathered here one more time. A year ago, it was about COVID. We called upon you, O God. You heard us. You intervened. You gave wisdom, direction, knowledge, and understanding. And today, we stand here to say thank you one more time. Lord, after COVID, you have come again with troubles, with issues, with health sector objectives, and we are portioning blames here and there. We have difficulties and challenges, but we believe in one thing, that with you all things are possible. We believe that when we call upon you one more time, Lord, you will do it and do it in a very beautiful way. We commit tomorrow into your hands. We commit Wednesday into your hands. We are asking that your presence will continue to be with us. We are asking that your grace will abound. We are asking that the power to break through will come upon us. We commit our health minister into your hands, the able leadership of the health sector into your hands. That, Lord, you will lead us by the way. And at the end of the day, when we sit down and we look back, we will say that, Lord, because you came into our boat. That the other day, when you were traveling with the disciples on the sea, and the sea was wavy and very rough, they called you, you calmed the seas, and everything became calm. We are saying that, Lord, the health of this nation is in your hands. We come upon you and we call upon you that you calm every wavy sea. We calm every situation. That tomorrow, all glory and honor shall be given unto you. As we are living, oh Lord, we are not leaving your presence. We are asking that you take us to our various institutions, homes, wherever we came from, safely. And bless us, bless everybody who participated virtually, in person, and those who will join us even from tonight and from tomorrow. We give you all the praise, Father. We give you all the glory, Lord. And we give you all the adoration. In the name of God, the Father, Son, and the Holy Spirit, have we prayed with thanksgiving. Amen. Put your hands together for the Lord. Thank you.
Obiero wanto wane wa yogi dalawai. Ifeno neng ni gwen ya erem gito chwer. Ifeno neng ni gwen baba ero rem gito chwer. Obi loto lui gangi bunde toke down. Obi lo lui gangi bunde toke down bye bye. Ondiega boro erolo nindara nenera bat mama we. Ondiega boro erolo nindara baba nenera. Ondiega boro hawe baba we. Hawe mama we. Hawe baba we. Hawe mama we. Hayu ya mundo moyo. Hawe baba we. Siko bebendero mwendo moyo Wala dunyengiri huru mwendo moyo Baba we Mwendo kuwero sema kono kwen Baba we Watoto yaye mwendo moyo Baba we Dunia ero mwendo moyo
Aona mziki uponyeshwa magonjwa, sisi twausherea bila matatizo. Joni kwetu mandekota nane okuwania kadie ombote mbote na bino mbote yetu ondule ndule na biso ndule yetu ombote mbote na bino mbote yetu ndule ndule na biso ndule yetu bashengesie mbote na bino mbote yetu ondule ndule na biso ndule yetu nina la sepopa de tota somana kande tota de tota mata kande tota de tota mata chaka. Mani fepa funyu sakadi dije Jebab dugumba gerte Wanim fa mana jema jilenen Do melni jubak jomak yaran ba Am the biligay